Welcome everyone to our webinar on Movement is Medicine. My name is Dr. Miguel Bonker Huertas. I am a chiropractic physician at Align Modern Health at our River North Clinic. For those of you who don't know us, we're a multidisciplinary clinic with a focus on integrative medicine. With chiropractic, we treat musculoskeletal pain, vertebral disc disorders, injuries, and support athletic performance. With clinical massage therapy, we treat soft tissues such as muscles, tendons, and ligaments. And functional medicine treats internal conditions such as gastrointestinal issues, low energy, inflammation, and acupuncture treats conditions of the mind and body and everything in between. Our goal is to get to the root cause and not just treat the symptom. So a little bit about myself. I specialize in movement disorders, musculoskeletal pain, and postural issues. I am particularly passionate about movement. Every day I use something called the McKenzie method, which is the most researched and validated treatment for musculoskeletal conditions to assess and treat my patients. And McKenzie is based completely on repetitive motions, repetitive movements. I assess with movement, I treat with movement, I set goals with my patients to always be able to move more. So why move, right? I'm gonna answer this question again towards the end of the webinar, but let's start by saying that when we move more, we put ourselves on track to feel better. The movement that I'm talking about is any kind of movement. It's changing the body or changing part of the body, changing position. It's going from one place to another using our own effort. Exercise, for example, is movement, and it has immediate and long-term effects, long-term benefits. So let's go ahead and look at some of those. Right, so exercise helps us sleep better. That means that we may fall asleep more quickly, we may wake up feeling more rested. It reduces stress and anxiety. We feel better equipped to face the challenges of the day because we're constantly challenging ourselves with exercise. And it also helps lower blood pressure, which is key to maintaining our cardiovascular health. And exercise also has more long-term benefits. So it benefits brain health. And that means that it reduces the risk of developing dementia or even Alzheimer's disease, and it reduces the risk of depression. It benefits heart health. It lowers the risk of heart disease, stroke, and type 2 diabetes. It helps with cancer prevention. It lowers the risk of 8 cancers: bladder, breast, colon, endometrium, esophagus, kidney, lung, and stomach. And it helps us keep a healthy weight. It reduces the risk of weight gain, it improves our bone strength, and it reduces the risk of falls by increasing our balance and coordination. Now, these benefits are clear reasons to exercise, but what if you don't have enough time to include 20 or 30 minutes of intense exercise a day? Or what if you already exercise, but you feel like the rest of the day you're sitting and sedentary and undoing what you've achieved with exercise? Well, this is where movement comes in, and specifically non-exercise movements that we can incorporate in any moment of the day. Another way of describing them, as you can see on the screen, is NEAT, non-exercise activity thermogenesis. Thermogenesis means producing heat. And it's the same kind of heat that you feel when increasing your physical activity. Non-exercise movements, supplements are exercising and helps us burn more calories and keeps blood pumping to our muscles. It keeps us alert, awake, focused, and improves our mood. And done enough, NEAT can come close to imparting the same benefits as regular exercise. So with our busy schedules this year, and this year having been particularly challenging with more people working from home and the limitations to the places where we can go and the activities we can do, I'm going to give you 7 ways to incorporate more movement throughout your day. So number 1, walking. Walking is a fantastic way of moving that also has the added benefit of not adding too much stress to the body and keeping cortisol, our stress hormone levels, down. If you have a dog and you normally take your dog for a walk, see if you can go a little bit longer. I'm sure your dog would love that. You can also walk and listen to a podcast, or my personal favorite, I like to walk and listen to an audiobook. And you can even listen into meetings, if it's allowed, listening to a meeting while you're on a walk instead of just sitting at the office. You can shoot for the goal of hitting at least 10,000 steps a day, or just hitting an extra 2,000 or 3,000 steps, more than you normally do. And the part that I love with walking is that, you know, all you need is some comfortable shoes and you can just go anywhere. Now, number 2, shaking. Shaking helps oxygenize muscles and helps us burn through the stress and tension that we accumulate daily. You can shake your body and limbs as if you're trying to shake off some water or some sand or some dirt. You can start with your hands, your wrists, your shoulders, knees, and ankles, and maybe even venture on to lie on the floor and shake for a whole minute. So I actually want you to try this with me. So you can stay sitting down. I'm just going to stand up just to make it easier. So I'm going to start with the wrists, okay? And start shaking as if you're trying to shake something off your hands. Right? Now you can go pretty quickly, you can go pretty slow. So imagine all the stress that's accumulated in your body, you're trying to shake it out your fingers. You can shake a little bit more. Good. So now, next, let's start moving the shoulders and shaking the shoulders back and forth. And again, you can move slowly, you can move a little bit more quickly. You can incorporate the wrists and the shoulders and start shaking around. Good. Now next, I'm going to sit down and I'm going to move my knees back and forth, right? So you can't see it, but imagine my hands are my knees. So I'm just kind of shaking them like back and forth. And again, it can be big movements or it can be small. And as I'm doing this, now my hips are starting to shake along with my knees. My shoulders are starting to shake along with my knees. My wrists and my elbows, until we get a whole body shake. And so let's try this for a couple of seconds. So go ahead, start shaking your fingers, shaking your shoulders, shaking your knees, shaking your ankles. You can wiggle one ankle to one side. You can wiggle one foot to the other. What we're doing is that we're releasing some of the stress on the body. We're releasing some of the tension. In a way of thinking about it is that we're kind of burning off the excess adrenaline that we accumulate throughout the day. Okay, awesome. All right, number 3 is play. One of my personal favorites. Remember when you were a kid and all you wanted to do was play? Anything could become a game. If you see a hopscotch game on the sidewalk, jump in. If there's something that you can climb, climb it. If you have a pet or a child, get down to their level on your hands and knees and crawl with them. Play for the sake of playing and nothing else, just like a child would. Say if you have a dog or a pet, you take them to the dog park and you throw the ball for the dog to catch. Next time you throw the ball, go chase after the dog with it. Come back, move around, make up a game and start playing the game. If you have a friend, a partner, someone, and if you have a child, ask them, how would you like to play today? And have them come up with a game, right? It's a great way to pass some time, especially if we're still spending some time indoors. All right, number 4, dance. So dance is just continuous movement, unrestricted. There are no rules, just start moving and don't stop. If it feels awkward, keep moving. If it feels great, keep moving. If it feels embarrassing, keep moving. If you don't know what to do, keep moving. Find some music that moves your feet, and you don't have to be a dancer to dance, but you have to dance to be a dancer. So I want you to try this with me. And again, I'm gonna stand up. You don't have to stand up for this one, but I want you to mirror me. So I'm gonna stick my hand out and imagine this was just a mirror, okay? So the first thing that we're gonna do is I want you to mirror my movement. I want you to open and close your hand. Simple. Now, I want you to start making circles with your hand. And so you're following what I'm doing as if you're watching yourself do this in the mirror. Okay. Now, don't worry about what it looks. There's no right or wrong way. Just do the best that you can. Okay. Now, with my index finger, I'm going to go back and forth as if making a figure 8. And notice that when I start making a figure 8, my elbow gets involved. It's going up and down. And that elbow is connected to my shoulder, which is also starting to move, right? And all you're doing is making a figure 8. Now, notice how your shoulder is moving the rest of your body, is moving your torso, is moving your ankles, your knees, your hips. And don't try to make it look a certain way, just notice it. Let yourself go, start moving, and now let's start adding the other one. So making a figure 8 with your other hand, going up, going down, starting to move your elbow, starting to move your shoulder. We're moving a little bit more quickly on this side. And now let's start adding both hands. So starting to move in the confines of this rectangle that you can see me in, and start moving your back and forth. And then let your elbows move your shoulders, and let your shoulders move the rest of your body. And you don't have to change anything, just start noticing what's happening with the rest of your body. Notice your ankles, notice your knees, notice your feet, notice your hips. And then bring your shoulders back and start moving back and forth. Good. Now, imagine you're holding onto a ball or a kettlebell, something heavy or something light, and that you're carrying this behind your back. You're moving it around your head and bringing it back in front of you. And then going to the other side, lifting it around, back to the front, and then going backwards. And now, as I said at the beginning, as part of dance, just keep moving and don't stop. Keep moving. Doesn't matter how it looks like. You can start going back. You can start going forward. You can stop halfway. You can turn around, and you can just carry this heavy ball wherever you want. Right? It can go underneath you. It can go between your legs and start moving around. All right, excellent. So that was just a little warm up. And what we're going to do is, now I know you can't really see me very well. I'm actually going to turn the camera down a little bit. Okay. So what I'm going to do is I'm just simply going to put all my weight on one foot, right? And I'm going to kind of lean my hip to one side, right? Now my other foot is completely bent. Okay? So you can't see it, but just imagine it. That foot is completely bent. Right now I'm going to place my weight on that other foot, and I'm going to bring my hips to the other side. And this foot right here is completely bent, right? And now I'm going to shift my weight backwards. Go this way. Now I'm going to go that way. So I'm shifting my weight here. I'm going to lift this foot up. I'm bending the knee. It's up here. It doesn't, and then I'm placing it back down, and I'm shifting my hips. Now let's do this a little bit more quickly. So I'm just shifting my hips, shifting my hips, shifting my hips. And so my knee is bending this way, my knee is bending this way. And so let's start going like back and forth, back and forth, back and forth. So it may look like you're just marching, but you're marching with your knees slightly bent as you're moving. So your hips are going to one side, your hips are going to the other, and to the other, and to the other. And I go a little bit more quickly. It doesn't matter what it looks like. It doesn't have to be perfect. And now you've just started dancing merengue wherever you are, in the office, in the home, at cafe, hopefully not in the car when you're driving. And there you go. That's simple. You've just been dancing merengue and you didn't even know it. All right. All right. So with dance, it doesn't have to be called dance, right? Dance is just movement, right? And it feels great and it has so many benefits to it. So all you need to do is just start moving and then don't stop, okay? All right, that was 4, so here we go on to number 5. This one's pretty simple. It's called sit to stand. This need is especially helpful for anyone who spends a lot of time sitting. Every couple of minutes, just get back up and sit back down. Essentially, you're doing a squat. And imagine if you did this every 10 minutes on an 8-hour day, you'd be essentially squatting more than 40 times in a day. Okay? So let's try this with me. So if you're sitting, just simply stand up and then sit back down. So imagine you're busy at work. These are my work fingers right here. And you're working, you're very focused on your work. 10-minute goes up, you just sit down, roll your shoulders back. So you stand up and then you sit back down. That's it, right? As far as time investment, you've only invested maybe 3 or 4 seconds, right? And if you did that throughout the day, you can keep yourself more alert and more awake. And then you're preventing the posture that we get whenever we're sitting for way too long. Okay? All right, number 6 is take the long route. Take the stairs instead of the elevator. Park further away and enjoy longer walks. Carry less groceries from your car and then take more trips. And get a little bit lost and explore a new part of town. All right, and number 7 is fidgeting. And fidgeting is making small movements while you're focused on something else. Say, for example, this webinar. Contrary to what you might think, it can actually help you focus and keep blood pumping to your muscles, to your legs, even if you've been sitting for a long period of time. So let's start fidgeting by simply moving side to side. Okay. Again, I can be working, right? And just simply moving my body side to side, moving my shoulders, my head is traveling with it. So this is one way. Now, the other way is to kind of incorporate something that we talked about earlier, is moving and shaking our legs, right? So we can open and close our knees and we can start tapping our foot down, right? So even if you're working and just you're tapping your foot, you're activating the muscles of the legs, and every time you activate your muscles of the leg, you're pumping blood down to the legs, but also blood back up to the heart, and so that way you avoid your legs, you avoid blood pooling in your legs. And another one of my favorites is something that we teach in the clinic a lot. It's called slouch overcorrect. So slouch overcorrect is just simply slouching, which we're pretty good at, but then overcorrecting and opening your chest as much as you can. So then you slouch, and then you open your chest. Do this with me. You slouch, you open your chest, and then you slouch, and then you open your chest. Let's do this 5 more times. And then slouch. Let's go a little bit faster. And then last 2, last 1, and back down. Okay, and before we finish with these, let's put it all together, right? Start by shaking, wiggling your shoulders. If you're sitting down, go ahead and stand up, sit back down, do a little merengue, do a little bit of dance, some continuous movement, something don't stop, and then sit yourself back down. Okay, so I talked about 7 ways to include more movement. There are obviously so many more, and on your screen you can see a couple of those examples. gardening, mowing the lawn, doing dishes, laundry, cooking, cleaning, picking up, even washing your hands for 20 seconds. All of that is movement. It doesn't matter how tiny the movement is. What I'm trying to teach is that any kind of movement counts. You can be blinking your eyes a bunch, and that is still movement. You're still changing your body from one position to another. Okay? Now, after all of these that we've tried, check in with your body. You should feel the effects of NEAT. Perhaps a little bit more awake, heart pumping some more, maybe your breath is a little fuller. This is how you know that you've been moving more. So again, I ask the question, why move? Move because you're meant to move. Because when we move, we feel better. We burn more calories, we clear our minds, we reduce stress. That's the medicine right there. Move because you can. Because our bodies are made in a way that rewards movement. Moving creates energy inside of your body that rids us of stress and anxiety. It's a cleansing. It's like wringing out a wet rag. If you feel stuck in any position, in any moment of your life, just keep moving. If after all of this, you're thinking, hey, Dr. Bunker, I'd love to move more, but I have restrictions, injuries, fears about movement, then let's have a conversation about how to overcome those challenges. We can schedule a 15-minute free consultation about which of our disciplines is the right one for you and how we can help you achieve your movement goals. All right, so we're going to open it up now to questions. If you can go to your screen on your menu, there's a Q&A button. You should go ahead and click on that. And if you have any questions, we've got a couple of extra minutes that we can answer them. So Ryan asks, what do you think about those mini ellipticals that go under the desk at work as a way of getting more movement? So I'm a fan of anything that creates more movement, as long as it's not so distracting that it keeps you from work. So those like mini like ellipticals, anything, especially when we've been sitting for long periods of time, blood pulls down on our legs, and that's when we start feeling achy and slow. So yeah, Ryan, I'm a big fan of anything that we can do that adds movement to when we're sitting for long periods of time. All right. Margaret asks, what is the best thing to do for tight hip flexors? So that's a great question. The best thing is, first of all, not spending too much time sitting down. Now, I know, with work that may not be possible, but that's why I say, you've been sitting for long periods of time, your hip flexors are going to be in a more like closed position. And if you stay that way, your hip flexors are going to get used to that, right? So when you stand up, you're straightening your hip flexors. So going from sitting to standing as often as possible would be great. So my recommendation is, if you don't have a standing desk or those desks that change like up and down, that you can go ahead and at least, stand up for a little bit, maybe move your computer to a counter if you work from home, just variety so that you're not spending too much time sitting. And then on top of that, doing some hip flexor stretches that we could, show you at a different time, okay? All right, Erin asks, if you have a standing desk available, how much time should you spend sitting versus standing? This is a great question, Erin. So we have a standing desk right here, and I do switch from sitting to standing. And what I try to do is, I don't have a particular time, but I have a feeling. So if I've been sitting and I notice that it's harder for me to maintain posture, that's when I need to change something, right? I usually don't last more than 15 or 20 minutes in any like one position. So then I'll stand up, and I'll start working on my computer. I'll start doing notes here. And then after about 15, 20 minutes, I might start noticing I'm fidgeting a little bit more. My legs feel like they want to move. And so that's when I change. I'll go into a different position. All right. So Anna asked, if you use under the desk ellipticals at low tension, is it still effective? Yes. Any movement, your muscles are pumping. So it doesn't have to be big. And this is why movement is more overarching than just simply exercise. When we think of exercise, we're thinking effort, right? Movement is just changing position, right? So you can have it at a low setting. I would definitely recommend not a high setting, especially if you need to focus on what you're doing. But if it's something that you can sort of do automatically and you can get comfortable with it, then yeah, any kind of movement that feels good. And if you want to challenge yourself, go a little bit higher and still be able to focus on your work, then that's great. All right, so Noemi asks, what would you recommend to avoid shoulder pain? So that is a great question that we can talk about more like one-on-one. And so there's a lot of things. And so in order for me to best answer that question, it would probably be more figuring out, well, what are the movements that are painful, and then we can think about what's a movement prescription to do to avoid that pain. Okay. And Wendy asks, is an appointment with me considered chiropractic evaluation in terms of how insurance is billed? So yes, so we, you know, our consult is free, right? We don't need anything for our 15-minute consult, but our initial exam lasts about an hour, and it is billable under insurance depending on the insurance company. So we're covered under Blue Cross Blue Shield, Aetna, and United Healthcare. All right, Medicare as well. All right. And so Anna asks, what about neck pain? My elderly aunt has neck pain when she walks. So again, this I would say would be a great conversation for us to have more one-on-one. And because I would need to know a little bit more information about like what could be causing it, if there's a history. When we do our initial exam here, we do a full evaluation where we check muscle strength, we check movement, we do orthopedic tests, we do a neurological test, we may do some x-rays, and we start progressing forces to see, well, what's tolerable and what we can do with movement. All right. So Laura asks, do we adjust our computers to look straight ahead rather than with our head bent? This is a great question. We talked about it in our ergonomics webinar. The computer screen needs to be just slightly tilted away from you, ideally at eye level. All right, so we've run out of time, but if you have any questions, you can feel free to email us, or you can call the number on the screen, 312-216-2452. You can also go to alignmodernhealth.com. Again, my name is Dr. Miguel Bonker Huertas, and we're at the River North Clinic. We have many other clinics as well, so if you live in different parts of Chicagoland, you might find a clinic that is closer to you. And once again, thank you so much everyone for joining, and I've had an awesome time, and I hope you did too. Okay, bye.